Now, I want to shift to a topic we've been hearing more about in the national news: monkeypox. The Ohio Department of Health has identified a probable case of monkeypox infection in an adult male residing in Ohio based on preliminary testing at the Ohio Department of Health's laboratory. Confirmatory monkeypox testing at the U.S. Centers for Disease Control and Prevention is currently pending. What I want to emphasize strongly at the outset is that monkeypox does not spread easily between people, and so the risk to Ohioans generally is very low. This disease is not like COVID-19, which, as we know, can be spread easily from person to person through the air over several feet in space. In contrast, monkeypox spreads between people primarily through direct contact with infectious sores, scabs, or body fluids. It also can be spread by respiratory secretions during prolonged face-to-face contact. Monkeypox, for example, can spread during intimate contact between people, including during sex, as well as activities like kissing, cuddling, or touching parts of the body with monkeypox sores. The Ohio Department of Health is working very closely with the CDC, relevant local public health authorities, and the affected patients' healthcare providers to ensure appropriate care for the patient. The case patient remains isolated and is following recommendations from public health and their medical providers. To protect the residents' privacy, the Ohio Department of Health will not be providing further details about this patient. Now, the Ohio Department of Health strongly recommends that anyone who's experiencing symptoms of an unexplained rash, including lesions on any part of the body, contact a health provider as soon as possible. People who are feeling ill should, of course, stay home unless seeking medical care. Monkeypox is a viral illness that typically begins with flu-like symptoms and swelling of the lymph nodes, progressing then to a rash. However, cases recently identified across the country appear less likely to have the initial constitutional symptoms of flu-like illness or lymph node swelling before the rash, which may look like pimples or blisters, and may also stay contained to a particular part of the body. Now, it's important to note that anyone can get monkeypox, even though most cases associated with the investigation in the United States have occurred among men who have sex with men. To date, the CDC has confirmed 49 cases in the United States. Worldwide, there have been nearly 1,500 cases confirmed, but no deaths reported. So again, while we do have a probable case of monkeypox here in Ohio, it's important to note that because the disease is not easily transmitted, there is very little risk to the general public.